Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on hyperthyroidism. So let us discuss what is hyperthyroidism. Hyperthyroidism is the overactive thyroid. Hyperthyroidism happens when the thyroid gland makes too much thyroid hormone. This condition also is called overactive thyroid. Hyperthyroidism speeds up the body's metabolism that can cause many symptoms such as weight loss, hand tremors, and rapid or irregular heartbeat. Several treatments are available for hyperthyroidism. Anti-thyroid medicines and radioiodine can be used to slow the amount of hormone the thyroid gland makes. Sometimes hyperthyroidism treatment includes surgery to remove all or part of the thyroid gland. In some cases, depending on what's causing it, hyperthyroidism may improve without medication or other treatment. As far as symptoms are concerned, hyperthyroidism sometimes looks like other health problems that can make it hard to diagnose. It can cause many symptoms, including losing weight without trying and fast heartbeat, a condition called tachycardia. And sometimes more than 90 beats per minute is referred to as tachycardia. Irregular heartbeat, also called as arrhythmia, pounding of the heart or palpitation, sometimes it is called as palpitations. Increased hunger and nervousness, anxiety and irritability, tremors, usually a small trembling in the hands and fingers, sweating. Tremors, usually a small trembling in the hands and fingers, changes in menstrual cycles, irregular cycles, and increased sensitivity to heat, changes in bowel patterns, especially more frequent bowel movements, causing diarrhea, enlarged thyroid gland, sometimes called a goiter, which may appear as a swelling at the base of the neck, tiredness, muscle weakness, sleep problems, warm, moist skin, thinning skin, fine brittle hair, and the gland swelling at the base of the neck will cause shortness of breath, problems in breathing. Older adults are more likely to have symptoms that are hard to notice. These symptoms may include an irregular heartbeat, weight loss, depression, and feeling weak or tired, fatigued during ordinary activities. When to see a doctor? If you lose weight without trying, without over exercising, or if you notice a rapid heartbeat, unusual sweating, swelling at the base of your neck, or other symptoms of hypothyroidism, make an appointment with your healthcare provider. Tell your provider about all symptoms you have noticed, even if they are minor. After a diagnosis of hypothyroidism, most people need regular follow-up visits with their healthcare provider to monitor the condition. And now we will come to the causes. Hyperthyroidism can be caused by several medical conditions that affect the thyroid gland. The thyroid is a small butterfly-shaped gland at the base of the neck. It has a big impact on the body. Every part of metabolism is controlled by hormones that the thyroid gland makes. The thyroid gland produces two main hormones, thyroxine T4 and triiodothyronine, which is T3. These hormones affect every cell in the body. They support the rate at which the body uses fat and carbohydrates. They help control body temperature. They have an effect on heart rate, and they help control how much protein the body makes. Hyperthyroidism happens when the thyroid gland puts too much of these thyroid hormones into the bloodstream. Conditions that can lead to hyperthyroidism include Graves' disease. Graves' disease is an autoimmune disorder that causes the immune system to attack the thyroid gland. That prompts the thyroid to make too much thyroid hormone. Graves' disease is the most common cause of hyperthyroidism. Then overactive thyroid nodules are other causes. This condition also is called as toxic adenoma, toxic multinodular goiter, and Plummer disease. This form of hyperthyroidism happens when a thyroid adenoma makes too much thyroid hormone. An adenoma is a part of the gland that is walled off from the rest of the gland. It forms non-cancerous lumps that can make the thyroid bigger than usual. Then another cause of hyperthyroidism is thyroiditis. This condition happens when the thyroid gland becomes inflamed. In some cases it is due to autoimmune disorder, in others the reason for it is unclear. The inflammation can cause extraordinary thyroid hormone stored in the thyroid gland to leak into the bloodstream and cause symptoms of hyperthyroidism. What are the risk factors involved in hyperthyroidism? A family history of thyroid disease, particularly grave disease, may be a risk factor. A personal history of certain chronic illnesses, including pernicious anemia and primary adrenal insufficiency, might be the risk factor, and a recent pregnancy which raises the risk of developing thyroiditis can lead to hyperthyroidism. Now we would come to the complications of hyperthyroidism, which are as following, such as heart problems. Some of the most serious complications of hyperthyroidism involve the heart, including a heart rhythm disorder called atrial fibrillation that increases the risk of stroke or CVA, cardiovascular accidents. And then another one is congestive heart failure, a condition in which the heart cannot circulate enough blood to meet the body's need. Then there are brittle bones. Untreated hyperthyroidism can lead to weak, brittle bones. This condition is called as osteoporosis. The strength of bones depends in part on the amount of calcium and other minerals in them. Too much thyroid hormone makes it hard for the body to get calcium into bones. Then there will be vision problems. Some people with hyperthyroidism develop a problem called thyroid eye disease. It's more common in people who smoke. This disorder affects the muscles and other tissues around the eyes. The symptoms of thyroid eye disease include bulging eyes or prolapsed bulging of the eyes, prolapsed eyes, and then gritty sensation in the eyes and pressure or pain in the eyes, puffy or retracted eyelids, reddened or inflamed eyes, light sensitivity, double vision, diplopia. Eye symptoms that go untreated may cause vision loss. Then discolored swollen skin is also a complication. In rare cases, people with grave disease develop Graves' dermopathy. This causes the skin to change colors and swell, often on the shins and feet. Then thyrotoxic crisis. This rare condition also is called thyroid storm. Hyperthyroidism raises the risk of thyrotoxic crisis. It causes severe, sometimes life-threatening symptoms. It requires emergency medical care. Symptoms may include fever, fast heartbeat, tachycardia, nausea, vomiting, diarrhea, dehydration, confusion, and delirium. Then we would come to diagnosis. Hyperthyroidism is diagnosed with a medical history, physical exam, and blood test. Depending on the result of the blood test, you may need other tests too. Medical history and physical exam. During the exam, your healthcare provider may check for slight tremor in your fingers and hands, overactive reflexes, rapid or irregular pulses, eye changes, warm, moist skin. And your provider also examines your thyroid glands as you swallow to see if it's larger than usual, bumpy, or tender. Blood tests that measure the hormones T4 and T3 and thyroid stimulating hormone TSH can confirm a diagnosis of hyperthyroidism. A high level of T4 and a low level of TSH is common in people with hyperthyroidism. Blood tests are particularly important for older adults because they may not have classic symptoms of hyperthyroidism. Thyroid blood tests may give false results if you take biotin. Biotin is a B vitamin supplement that also may be found in multivitamins. Tell your healthcare provider if you are taking biotin or a multivitamin with biotin to make sure your blood test is accurate. Your healthcare provider may ask you to stop taking biotin 3 to 5 days before the test. If blood test result shows hyperthyroidism, your healthcare provider may suggest one of the following tests. They can help find out why your thyroid is overactive, such as radioiodine scan and uptake test. For this test, you take a small dose of radioactive iodine called radioiodine to see how much of it collects in your thyroid gland and where it collects in the gland. If your thyroid gland takes in a high amount radioiodine, that means your thyroid gland is making too much thyroid hormone. The most likely cause is either Graves' disease or overactive thyroid nodules. If your thyroid gland takes in a low amount of radioiodine, that means your hormones stored in the thyroid gland are leaking into the bloodstream. In that case, it's likely that you have thyroiditis, which is inflammation of thyroid gland. Then we have a special test which is thyroid ultrasound. This test uses high frequency sound waves to make images of the thyroid. Ultrasound may be better at finding thyroid nodules than our other tests. There is no exposure to radiation with this test, so it can be used for people who are pregnant or breastfeeding or others who cannot take radioiodine. Then we will come to the treatment. There are several treatment options available for hyperthyroidism. The best approach for you depends on your age and health, the underlying cause of hyperthyroidism, and how severe it makes a difference too. Your personal preference also should be considered as you and your health provider decide on a treatment plan. Treatment may include: number 1, anti-thyroid medicines. These medications slowly ease symptoms of hyperthyroidism by preventing the thyroid gland from making too many hormones. Anti-thyroid medications include methimazole and propylthiouracil. Symptoms usually begin to improve within several weeks to months. Treatment with anti-thyroid medicine typically lasts 12 to 18 months. After that, the dose may be slowly decreased or stopped if symptoms go away and if blood test results shows that thyroid hormone levels have returned to the standard range. For some people, anti-thyroid medicine puts hyperthyroidism into long-term remission, but other people may find that hyperthyroidism comes back after this treatment. Although rare, serious liver damage can happen with both anti-thyroid medications, but because propylthiouracil has caused many more cases of liver damage, it generally used only when people cannot take methimazole. And propylthiouracil can be used in pregnancy as well. A small number of people who are allergic to these medicines may develop skin rashes, hives, fever, or joint pain. They also can raise the risk of infection. Then we have another type of medicines which are called as beta blockers, which are used in hyperthyroidism. These medicines do not affect thyroid hormone levels, but they can lessen symptoms of hyperthyroidism, such as tremor, rapid heart rate, and heart palpitations. Sometimes healthcare providers prescribe them to ease symptoms until thyroid hormones are closer to a standard level, such as Calan-SR, and calcium channel blockers such as propranolol is also being used. These medicines generally are not recommended for people who have asthma. Side effects may include fatigue and sexual problems as well. They may cause erectile dysfunction as well. Another option, which is radioiodine therapy. The thyroid gland takes up radioiodine. This treatment causes the gland to shrink. This medicine is taken by mouth with the treatment. People symptoms typically lessen within several months. This treatment usually causes thyroid activity to slow enough to make the thyroid gland underactive. That condition is hypothyroidism. Because of that, over time, you may need to take medicine to replace thyroid hormones. Then we have the option of surgery, which is thyroidectomy. So this is a surgery to remove part of or all of the thyroid gland, and when one of the lobe is surgically removed, then it is called as lobectomy. Thyroidectomy is not used often to treat hyperthyroidism, but it may be an option for people who are pregnant. It may be a choice for those who can not take anti-thyroid medicine and would not take or want or cannot take radioiodine therapy. Risk of this surgery include damage to the vocal cords and parathyroid glands. The parathyroid glands are 4 tiny glands on the back of the thyroid, and they help control the level of the calcium in the blood. People who have a thyroidectomy or radioiodine therapy need lifelong treatment with medicine levothyroxine, levoxyl, and L-troxin. It supplies the body with thyroid hormones. If the parathyroid glands are removed during surgery, medicines also is needed to keep blood calcium in a healthy range. Thyroid eye disease. If you have thyroid eye disease, you may be able to manage mild symptoms with self-care steps such as artificial teardrops and lubricating eye gels. Avoiding wind and bright lights can help too. More severe symptoms may need treatment with medicines called corticosteroids such as methylprednisolone or prednisolone. They can lessen swelling behind the eyeballs. The medicines Teprotumumab, Tepezza also may be used to control moderate to severe symptoms. If those medicines do not ease symptoms, other medicines are sometimes used to treat thyroid eye disease. They include tocilizumab, Actimra, Rituxan, and mycophenolate mofetil, Cellcept. In some cases, surgery may be needed to treat thyroid eye disease, including orbital decompression surgery. In this surgery, the bone between the eyes sockets and the sinuses is removed. In this surgery, the bones between the eye socket and the sinuses is removed. This surgery can improve vision. It also gives the eyes more room so they can go back to their usual position. There is a risk of complication with this surgery. If you have double vision before the surgery or diplopia, it may not go away afterward. Some people develop double vision after the surgery. And then we have eye muscle surgery. Sometimes the scar tissue from thyroid eye disease can cause one or more eye muscles to be too short. This pulls the eyes out of the alignment, causing double vision. And eye muscle surgery may correct double vision by cutting the muscle from the eyeball and attaching it again farther back. Then you will come to the lifestyle and home remedy. Once you begin treatment, symptoms of hyperthyroidism likely will get better. Along with your treatment, your healthcare provider might suggest that you will reduce iodine in your diet. It can make hyperthyroidism worse. Keep pulse and other types of seaweed contain a lot of iodine. Cough syrup and multivitamin also may contain iodine. Graves. Now we will come to grave disease. If you have grave disease that cause eye or skin problem, taking the following steps may help these symptoms. Please kindly don't smoke. Smoking has been linked to the development of thyroid eye disease. It can also make that condition worse, and smoking can cause symptoms to come back after treatment. It will be damaging to your lungs as well and causing bladder cancer as well. Keep your eyes lubricated. Eye drops may help relieve dryness and scratchiness. A cool compress also can provide moisture. If your eyes do not completely close, a lubricating gel at bedtime may help keep the cornea from drying out. Some people also tape their eyelids shut while they sleep. Protect your eyes. Wear sunglasses to help protect your eyes from the sun and wind. Keep your head up. Raising the head of your bed may lessen swelling and ease the pressure on your eyes. Use creams for swollen skins. Creams containing hydrocortisone that you can buy without a prescription. Cortisone 10. Others may help ease swollen skin on the shins and feet. For help finding these creams, you may ask with your pharmacist as well. If you have not been diagnosed with hyperthyroidism, it is important that you get the medical care you need after you and your healthcare provider have decided on a treatment plan. There is also something you can do to cope with the condition and help your body heal. Get regular exercise. You will feel better. It improves muscle tone and helps keeps your heart and lungs healthy. Exercise can also help you feel more energetic. Learn relaxation techniques. Many relaxation techniques can help you to keep a positive outlook, especially when coping with illness. Research has shown that for grave disease in particular, stress is a risk factor. Learning to relax and find a sense of calm may help sustain your physical and mental well-being. Preparing for your appointment, you will likely start by seeing your primary care provider, but you may be referred directly to a specialist in hormone disorders, called as an endocrinologist. If you have an eye problem, you may be referred to an eye doctor, also called as ophthalmologist. Here's some information to help you get ready for your appointment and to know what to expect from your healthcare provider. What you can do: be aware of any appointment restrictions when you make the appointment. Ask if there's anything you need to do to get ready for it, such as not eat or drink for a certain amount of time. Write down any symptoms you have, including any that may seem unrelated to the reason for which you scheduled the appointment. Write down key personal information, including any major stresses or recent life changes. Make a list of all medicines, vitamins, or supplements you are taking, especially any supplement or vitamin containing biotin. Take a family member or friend along with you, if possible. Someone who is there with you may remember information you missed or forgot. Write down questions to ask your healthcare provider. Writing a list of questions will help you make the most of your time with your healthcare provider. And for hyperthyroidism, some questions to ask include: what's the most likely cause of my symptoms? Are there other possible causes? What tests do I need? to cure for it? Is my condition likely temporary or long lasting? What treatment options are available for me, and which do you recommend for me for my condition? I have other health conditions as well. How can I manage these conditions together? Should I see a specialist? Is there a generic alternative to the medicine you are prescribing me? Do you have brochures or other printed material I can take? What website do you recommend for me for learning about my disease? Do not hesitate to ask other questions. What to expect from your doctor? Your healthcare provider is likely to ask you some questions, including when did your symptoms begin? Have your symptoms been continuous or occasional? How severe are your symptoms? What, if anything, makes your symptoms better or aggravate? What, if anything, makes your symptoms worse? Do members of your family have thyroid disease? Have you had any recent radiology scans that use intravenous contrast or any previous surgery? So it was all about hyperthyroidism. I think so that this topic would be more informative for the audience, and you would have liked it. If you have liked it, then kindly don't forget to subscribe my channel and share this video with other individuals as well who are having the symptoms of thyroid disorder. And thank you for listening this video. Have a wonderful nice day.